Hi, everyone, and welcome to Mid Monday. Let's get started. Today's medication is furosemide or Lasix. It's a loop diuretic. It can be given PO, IV push, or through an IV drip. It inhibits reabsorption of sodium and chloride at the proximal and distal tubule in the loop of Henle. So, working in those kidneys there. So, the indication or why we give this medication, there are several. The first is hypertension, ascites, and that would be from liver failure, nephrotic syndrome, heart failure, pulmonary edema, and liver disease. So, contraindication is why we don't give this medication, and that is anuria, which means no urination or no production of urine, hypotension, hypokalemia, and severe renal disease. So, our side effects, which are non life threatening, include fatigue, weakness, orthostatic hypotension, tinnitus, and low electrolytes, and that would include potassium, chloride, and magnesium, and metabolic alkalosis and polyuria. So, our adverse reactions, which are life threatening or can be life threatening, include circulatory collapse, meaning hypotension, severe hypotension, where patients then require fluid resuscitation or vasopressors to support their blood pressure. Renal failure, thrombocytopenia, agranulocytosis, leukopenia, neutropenia, anemia, and Stevens-Johnson syndrome, and then also toxic epidermal necrolysis. So, our nursing considerations or things we need to think about when we're administering this medication, it increases toxicity with digoxin, salicylates, and aminoglycosides. And there are other medications that can potentiate Lasix or that Lasix can potentiate, meaning make stronger. So, we need to be aware of that and monitor our patients. Ototoxicity with vancomycin and aminoglycosides. We need to administer carefully with other antihypertensives and nitrates because our patients can develop hypotension. We need to make sure that we weigh our patients daily and have accurate intake and output so that we can see if our therapy is working, whether we need to increase or decrease our dosages. And we need to assess for hypotension and orthostatic hypotension. And we should be doing that with all of our antihypertensives, especially when they're newly administered and the patient is just now starting to take these. We also want to watch out for hypokalemia, and we want to monitor our BUN, our potassium, sodium chloride, and our creatinine. We also want to monitor glucose and diabetics. So, for patient teaching, there are several points we want to make sure we emphasize, and that patients need to have some type of potassium replacement. And typically, bananas is not going to be enough. They usually have to have an oral supplementation. Changes in position slowly because we want them to avoid orthostatic hypotension until they become acclimated to the medication. We want them to be aware of the side effects and adverse reactions so that they can report these to the physician. We also want them to monitor their blood pressure and their weight. Now, this may not always be prescribed per se by the physician on discharge, but we do want to make sure that we educate our patients that they do monitor their blood pressure and their weight and report these to the physician regularly so that we can assess whether this medication is working at the current dose, whether they need a higher dose, they may need a lower dose, and it's good for the patients to be involved in their own care. We also want them to use sunscreen because they can become photosensitive. We want them to also take this early in the day to avoid sleeplessness. And basically, they will be up peeing all night long if they don't take this early enough. In the hospital setting, I try to administer this as early as possible, usually at 5 and 5, like 5 a.m., 5 p.m., so that the patient isn't up all night having to go to the bathroom, because we all know what adequate sleep, how that's so important for them. So, our challenge question for today is: the nurse practitioner orders Lasix 40 milligrams IV push BID um, for your heart failure patient. The pharmacy sends a vial with 100 milligrams per 10 mLs. How many mLs will you be giving for the day? So if you leave your answer in the comments, you will be entered to win a $25 Amazon gift card, and the winner will be announced next Monday. So thank you so much for joining me for Med Monday. If you want to subscribe to our Med Monday and receive the weekly fun sheets that go along with the teaching, you can go to NursingSchoolSimplified.com/Med Monday, and we will see you next time. Thank you very much.